Last week we discussed the number one reason that people end up, number one pain-related reason that people end up going to the doctor. Today we're going to talk about the number two reason, neck pain. And again, just like with the lower back pain, a lot of times people are said it's tight hamstrings or different things like that, and that's not usually the problem. Same thing happens with the neck. A lot of times we're told that the problem is right up across here, and sure, that's where a lot of the pain comes from, but that is not the underlying problem, and that's what we're going to dive into today. I'm Dr. Jeff Cumro, and over the past 15 years, I've worked with over 5,000 patients, and a lot of the stuff that we're going to talk about is not stuff that I was taught in school. It's not really the mainstream stuff that is taught today, but over the course of studying, functional medicine, studying movement-based stuff, biomechanics, studying neurology. I mean, there's a lot of different things that are coming here. And then you have the experience of working with that many patients. You're going to learn some things, right? So ultimately, the biggest thing that I have learned, and we're going to draw once again, but the biggest thing that I have learned is, once again, posture plays a massive role in this. Just like the pelvis was tipped forward in a lot of cases in the lower back, when we look at the upper back, we end up with a slouch posture. And what we should see is we should have our person standing and, really their heel, or really right back here, should be right in line with the ear, which should be in line with the shoulders, should be in line with the hips. What we stereotypically will see, and this is exaggerated on some people, and we'll get into that. Other people, you'll see it mildly, and a lot of people, you'll see it as they age, it gets worse and worse. But what we'll see is the head gets carried a little bit more out front, and they end up with kind of a posture like this. Now, this is obviously exaggerated for our purposes, but they end up carrying their head in front of their pelvis, and either their weight is over their toes or their weight is back here, but they're compensating with this part of their body to actually get there. So they end up with that slumped forward posture. Their shoulders are brought into that position that puts a lot of strain on things. And what are things that lead us to this? What do we do all day? We stand at a desk. We, work at computers. We drive. Everything we do drives this forward. As far as guys go, we like to strengthen the muscles that we can see, right? A lot of people kind of forget about the back because they can't see it. So there's a lot of chest work that gets done by guys. Women have an added disadvantage on this. The weight of the breast tends to bring their head and neck forward. Carrying children or feeding children, you've got your arms in front of you. Recliners tend to bring us into this position. So there are a lot of things throughout the day that we do that continue to bring us more and more into this position. Now, just like lower back, when we talked about the lower back, stereotypically where we see the problem is you have the tightness start to develop in the quads. You have this tightness start to develop in this lower back. That leads to weakness here and weakness here. We see a similar thing in the upper body. So let's just draw another stick figure here. What we see on the upper body is we start to get tightness in the chest and the back of the neck. We start to get some weakness here and here. Now, a lot of times when we work on these muscles right here, it's going to be very, very tender. The muscles are going to be tight. Why are those muscles tight? Because they're working in ways that they're not designed to be working. Why are these muscles tight? Because they've got extra strain on them as you start to bring that head forward. So as we start to carry our head a little bit more forward and a little bit more forward, these muscles back here have to work harder and harder to keep our heads in those upright positions. And you've probably seen those people who walk kind of like this. They're slumped forward, and they've got that arch in their middle back. So they end up with the hump right through this region to kind of compensate for this. But their head has to be brought way back to actually see. This is a bad, bad thing. It changes how they breathe. It changes how their gut works. It changes, obviously, how their musculature works. There's so many things that go into this, but it starts to wear on us. And it starts to wear on us for a couple of reasons. A, it's harder on the muscles, but B, it also puts your joints at a disadvantage. They're used in ways that they weren't designed to be used. And just like in the lower back, when our joints are used in ways they're not designed to be used for long periods of time, you start to see more wear and tear. You start to see more inflammation, and over time, we end up with degeneration. This ends up with arthritis or different things like that. Causes a lot of problems, right? So what do we end up wanting to do on this? It's going to be very, very similar. So when we looked at the lower back, we have the tightness in the quads, we have the tightness in the lower back. We want to strengthen the abs and strengthen the hamstrings to tilt that pelvis back on the upper part and forward on the lower part. Bring everything back into balance. Same thing needs to happen on this. Let's just go back a couple things here. So instead of having our shoulders brought forward, we want to work to bring the head back and bring this middle back into more alignment, right? Instead of having that arch in this lower back or this upper back, having this arched here, we want to bring that forward so we have our weight, the weight of our head right over the weight of our shoulders, over the weight of our hips, over the heels. And when we can restore that, we win. But we end up with weakness back here in most cases. So by strengthening this back here and doing things to really, I don't know that I even like to strengthen these muscles so much. Really, right back in here is the biggest thing that we want to strengthen. And we'll get into how to do that in just a moment. But, anytime we're working with the neck, a lot of times strength is something that's, I don't want to say it's hard to get to, but getting to the right areas can be a little bit more difficult for more people. So we'll dive into more stretching that you could do for that. We're gonna want to stretch this here, and we're gonna want to stretch this here. And this is what most people strengthen, right? They end up strengthening their chest. They end up doing bench press and incline press and shoulder press and all these different things that drive a lot of this functionality through here, but they forget about this back here. So what are some of the stretches you can do? Some of my favorites are the one where you grab the chair that you're sitting on. So you're going to anchor with one hand and you're going to lay your head to the opposite side. And you can kind of roll forward and backward and stretch these muscles over here. You can bias that a little bit. When you bring your head forward a little bit more, it's going to hit these muscles in the back. As you bring it back, it's going to stretch some of these muscles in the front side. Great stretch for this. Doing anything like child's pose is a really good one here. So the first one we'll call an anchored neck stretch. Second one, child's pose. And child's pose, if you go from side to side, you'll feel it even more. So it can give you a very good stretch. And then the big thing on this is chest stretch. Getting into a doorway and opening up, or getting your arm back on a wall, or different things like that to open this up. If we can open this up, it gives us a lot of a boost, right? Because we're here all day. So this gets tight, but we also strengthen this more too, right? So we've got to really work on bringing those shoulders back. If this area doesn't work the way that it's supposed to, the weird part about this is where your shoulder stability comes from. So if you can't fire this muscle right in here, it comes to the front of the shoulder blade. When you lose that, you lose the ability to keep your shoulder blade on your rib cage. So it ends up arching your shoulder, kind of flaring it out. It's called the wing scapula. And you end up like this. So it actually exacerbates this. It makes it worse and worse. So working to strengthen that is going to be a good thing too. But we've got to stretch the chest and make sure we have functionality in there. So how do we strengthen these areas? When we do things like TYIs, and you can Google any of these things to figure out how to do them. TYI is going to be a really good one. It's going to strengthen that lower trap. That's going to help to provide that girdle that holds those shoulders back. Doing things like, what are those called? Anything for the serratus anterior. If you look that up, there's different types of push-ups and body holds and different things like that you could do to gain that back. That's going to be a very good one. Rear delt flies. Things like this are going to be really strong for building the posterior shoulder, building that upper back to form that girdle that we need to hold ourselves upright, to maintain the posture that we need. And when we do that, it takes all of the strain off of here. Now, a lot of people do have that tightness right up here. Why do they have that tightness? It's because as we start to carry the head more and more forward, it puts more and more strain on here. When we have our posture the way that it's supposed to, that ear is right over the shoulder, head essentially weighs 0. It doesn't take any extra force to really maintain our posture. As soon as we get to here, it's about 10 pounds of pressure. As soon as we get here, it's about 20. And as soon as we get here, it's about 60. So it starts to get more and more the further you bring that head forward, and it starts to add up very quickly. So when we can take that away, when we can get that posturing correct, these muscles up here aren't getting pulled on. They're not getting strained the way that they were before. So it takes a lot of strain off of that. When we can get these muscles loosened up, these muscles don't have to work as hard to pull back. So we minimize the number of, spasms that we have back here and things like that. And this is called upper cross. We called the one down here lower cross. This up here is upper cross. So we're working on building the strength in the areas and ratios that we need. We don't want the strength to be equal. Doesn't mean your chest and your upper back should be equal in strength. What we want is it to be balanced in strength. And once we start achieving that, we start to minimize the strain on the muscles, we start to minimize the wear and tear on the joints, and we start to get you out of pain. So as always, if you have questions on this, reach out. I love talking about this stuff. Obviously, I talk about this stuff all day long, and I go home and I study it when I'm done. So it's something that I love to talk about. And, as always, I appreciate your time. I appreciate your attention. I know they're your most valuable resources. I appreciate you spending some of that with me. Hope that you have a phenomenal week, and I will catch you on next week's video.